Tonight, we take another look at the toll of the COVID-19 pandemic on the mental health of children and adolescents in the U.S., as data shows the proportion of mental health-related pediatric visits to hospitals has increased. According to findings from the Centers for Disease Control and Prevention, from mid-March to October of this year, the proportion of mental health-related emergency department visits increased 24% among children ages 5 to 11 and 31% among adolescents 12 to 17 years old compared with the same period in 2019. Joining me now on Skype is Dr. Suzanne Hollman, clinical psychologist and director of clinical operations at Georgetown University Counseling and Psychiatric Services. Dr. Hollman, welcome back and good to talk to you again. So what are some of the unique challenges for young people during this time of uncertainty?
I think we've seen, as parents and educators, we've seen a lot of things already that's easily observable. We've seen them respond to social isolation. We've seen their plans being cancelled. We've seen sports teams being disrupted. So I think there's in many cases, a sense of identity that feels like it's getting lost, and that there's certain developmental tasks that have been delayed at this time.
Can you talk about some of the potential long-term effects of isolation and missing out on those milestones that they've looked so forward to? You know, we hear so much about the resiliency of young people, but is that really the case?
You know, I have looked into this over the last few weeks, and there is no data to suggest that these short-term effects of irritability, anger, a bit of a malaise, disappointment is necessarily a long-term effect. What determines whether or not it will be long-term is how we respond to it. A strong family bond, even in the midst of adversity, attempts to continue activities as much as possible, even if they occur virtual. The risk factors are family unity that does not persist, or instances in which there are pre-existing conditions of anxiety and depression that is left unaddressed that could be exacerbated by social isolation. But the little bit of good news is the preliminary data we have says that most young people should recover from this.
Well, that is good news. What should parents and teachers look out for, and how can we discern whether or not the behavior that our child is displaying is normal or something that may be more serious? What can we do to help?
I think that's a great question. I think the first thing is to be very aware of where your child or your adolescent or your college student is. What are the losses that they've experienced? Is it a loss of not being able to see their best friend anymore? Is it a loss of a sports team? Maybe they wanted to try out for that ice hockey team they've been practicing for 4 months. First, being aware of what have they lost, and then comparing how they are now. How do they seem to you now compared to a year ago? And if you notice really big differences, like sleeping a lot or overeating or getting irrationally angry beyond what is a normal response to such a terrible situation, if they don't seem like themselves and they have vegetative symptoms, as we would call it, in disruptions in sleep and eating, nightmares, feeling really tired, that is a time to start really looking closely at how are they doing. Not just what they say, because adolescents and children do not often tell you what's going on, and they may not even be able to.
Yeah, that is certain. And you know, our young people aren't the only ones who are struggling right now. Many adults are also having a difficult time. How can we recognize signs of trouble maybe in ourselves?
I think it's very similar. If you find that you are not able to do the things that you used to enjoy as much, if you have to force yourself to go on a walk or call a friend, if you just want to be on your own, if you're more snappy than usual with your family, those are all warning signs. And I would suggest paying attention to the warning signs earlier as opposed to later and reaching out for help. You know, this is also an opportunity. After SARS, a survey in Hong Kong found that 28% of the people surveyed actually reported receiving increased support from friends. And 39% said that for the first time they actually felt more supported by family members during SARS than before. So there's an opportunity here. And I think as Christians and as Catholics, Pope Francis did a press interview, or he did there was something in the press a couple of weeks ago, and there was a quote that really stood out for me. He said, "Those who serve others are the antibodies to the virus of indifference." And we know that when we reach out to other people, we feel better in the process. And so I think it's not just enough to notice what's wrong. That's certainly the starting point. But what we do with that is really important. And as Catholic Christians, in a way, we could say that this is what we were built for. This crisis is exactly the kind of situation that we're actually quite well equipped for because of our orientation of service to others and love for those around us.
Dr. Hollman, thank you so much for your time today and for your advice. We really appreciate it.
Thank you so much for having me.